My name is Chinasa Lovelyn Onwachukwu and I am a mental health advocate. Mental health in Nigeria is often misunderstood and many of us suffer in silence due to stigma, cultural beliefs, lack of awareness and limited support. The purpose of this documentary is to create a safe space for us to talk about mental health, what it means to us, the challenges we face in our society and what needs to change. This is our story.
I think mental health is overall health, and it's the ability to be able to cope with adverse events, get up to do tasks, be productive, perform at your optimum level.
Mental health is the overall ability of a person to effectively think, act, and do well.
Mental state can be bad or good. So it's just like the states of your mind.
Mental health is the state of your mind.
But to me, mental health might be the cocoa. If you don't get mental health, you don't go get anything for this life, like your physical well-being, your emotional well-being, how you take even relate with people self. So for your mental health, you're all right. I tell you, nothing will go away for your life. You could just be stagnant for one place, like stagnant water. No, if you move forward.
Mental health is as important as physical health because I believe your mind controls your physical. If you're not sound in mind, your body cannot just be sound. That's just the truth about it. So your mind rules your body. So you need to be mentally sound for you to also be physically fit.
If anything happens to your mental health, it also affects the body. Like there's something we call somatization. There are some experiences you have that once you begin to have emotional troubles like inability to sleep, you're feeling withdrawn, your mind is not at rest, then you begin to develop some physical symptoms like migraines, stomach issues, and even ulcer, because there's been a research that shows the link between gut area and the brain. So mental health is very important, just as physical health.
Of course, mental health is, I can even say that mental health is what controls physical health most of the time. Because I have heard stories where people who are not even all right, there was someone who had cancer and was told that he was treated at the hospital and he got better. Somebody who didn't have cancer was told that he had cancer and he eventually had cancer. So I feel like mental health is what controls the whole, the majority of our health, of our living, most of the time. Yeah.
I believe that mental health is just as important as physical health because I basically believe that your mental health it's what determines like everything in your life. Like it's what determines what you do, how you act, how you eat. It's basically more important than physical health.
Mental health is vital because it affects your thought pattern and your association with other people.
In this environment, in our society, there's a whole lot of lack of awareness, lack of information about what mental health is all about. So people misunderstand someone struggling with mental issues. They define it in so various ways. Some could attribute it, some get angry. Some of the reactions could be anger, some could be accusations. It could vary. They could say you're mad, and they could even accuse you of being spiritually tormented by some evil spirits. So people react different ways.
The society's reaction to mental health is very radical. The belief system about the fact that mental health is a cause, or the fact that when you mention that you are mentally ill, they just consider you to be insane. And also the fact that people who are also considered to be gifted are also seen as being mentally ill. So I think the society is not really doing so well when it comes to the understanding and awareness of what mental health is.
The height of nonchalancy in the society is crazy and deafening. People don't really care about people that struggle mentally, probably until it's gone completely.
More society they take am poorly in the sense that if person don't get mental health issue now, just maybe you go through depression or one or two things like that for your life, maybe you just dey struggle and in this sad. More society will take am like say you don't dey run mad, you don't dey run mental. But if na young person now like me, you go think say I don't dey do drugs, I dey take drugs, normal drug, all these hard drugs, I dey take alcohol, I dey smoke. So society no dey take am as something really important wey be say they suppose put eye on top, wey they suppose watch the person, talk to the person. Society dey take am the other way around. They go just talk say, son na small pikin abeg, make just. But by the time he go learn by himself, he no go even care about him whole lifestyle or anything.
Of course, as long as you're human and you live life, there are times that it comes with a whole lot of challenges, things that you are new to, and they have a whole lot of impact on you. So yes, I've been there several times. I've been drained, I've been stressed. But one thing I've come to realize over the years is that nothing is permanent, they are transient. So as they come, they'll also move. All you need to do is just focus on being strong and trying to see beyond that particular time. That's what keeps you going.
I think all my life I've been emotionally overwhelmed and drained, and specifically I was diagnosed of hypomania in 2021, and as a mental health therapist myself, I got to a point where I couldn't handle it. I became suicidal, and I knew that I needed help beyond myself, so I sought help. And as much as I do not really like to depend on medication, I was placed on medication for a while, and I decided to just handle the rest by myself, using a blend of techniques like mindfulness-based interventions, dance movement therapy, journaling. And what really helped me the most is accepting myself for who I am, because I know I was different, and I think that was the beginning of my emotional issues. And coming to accept me for who I am, regardless of what other people think, helped me to become mentally stable, and I think now I'm in a safe space.
Yeah, in Nigeria, of course, yes. There are a whole lot of things that can drain you. When I'm tired, I eat. EFs. I sleep. If I don't sleep, sometimes I just write, or I talk to people that I love. Yes, EFs me too.
Yes, I have. I cried. I accepted myself for who I am. I exercised, and I prayed. Lastly, I spoke out.
Growing up in Nigeria, growing up in every family you come from, one thing or the other, even as adults right now, the whole economic situation would cause you to get mentally stressed or emotionally drained. So music helps me cope when I'm emotionally drained or mentally overwhelmed.
I guess find something where I go feel they do, we go to keep me busy. So I can't listen to music, because to me, music is the best therapy for this life. Anything just they go through, my guy, just jam up to one or two vibes. I sweat down, you could do alright. Especially now good music, you could do alright. Guy won't be music is the best therapy for this life. And then another thing what they always do now to chop food. Because if you chop food well, I tell you, your mind will do alright. Your mind will be in the right place.
We don't even have a whole lot of information about mental issues or mental health, so we don't even have the facilities to take care of someone struggling with it.
I think enough is overstatement. Nigerians don't have access to quality mental health services because over 90% of people living with mental illness in Nigeria do not even seek help at the hospital. And this is due to stigma, low-skilled personnel, and even long appointment time at the hospitals.
No, I don't think that Nigerians have enough support.
Nigeria is poor when it comes to mental health and services. It's bad, because I feel if the society as a whole is aware of this, that would start up to having a very good service from probably the government and other practitioners also. So
Well, once people hear mental, they just assume you are mad. There's also the part that where they could say you have abused some substances. That's what has triggered your decline in mental coherence and all that. So there's a whole lot of misconception. If you're not called mad, they will call you a drug abuser. There's so very many things people have said and are still saying in our society. Some could say you're acting up. Or they will say somebody visited you from your village and you are spiritually being attacked. That's why you are having mental issues and all that.
A lot of people think that when you're mentally ill, it is either you have done something wrong, or there is a curse upon your lineage, or you're experiencing generational curse, or maybe you've engaged in substance abuse and other issues. But people are not aware that little trauma and big traumas also contribute to mental health issues. For instance, experiencing childhood neglect can impound your mental health, and if not treated or if you don't get support on time, you could end up living with depression or cyclothymia or even bipolar later in life.
If one person just twitch like this or in head just touch small, first, maybe not depression, I go just sit outside, just day lonely, just say, this one, they don't give my breakfast, they don't serve my breakfast. Or maybe in go hustle. The money where you can't make, you say make you go try invest more. You can't, this you can't cut. Most just say in go bets can't cut. Or the investment we go do, the people can't run away with their money. Just like this C-bets now, my guy running with $800 million. Oh boy. Many people go they depressed, no be small. And I really don't know. We really got to do something about them. Because we even need to tell our community people, our friends, everybody, we need to educate them on this kind of thing. If we not educate them, they go they misyan to people, they not go they see how people take the day depressed or go through mental health issues. And they go feel say everybody could just do alright. And they make sense.
But I think that Nigerians need to include mental health in the National Health Insurance Scheme so that professionals, business owners, even individuals can access mental health services at a lower price. So I think Nigeria should integrate mental health therapy into other existing industries and also allow alternative healers and spiritual healers to come together and work as an interdisciplinary profession in the healthcare system, because we can't rule out our beliefs from our minds. Our beliefs shape our mindset. And as humans beings, the body, mind, and soul are connected. So once one part is affected, the rest of the other parts are affected. So integrating spirituality into healthcare system is another way to go in improving mental health access, support, and then implementation for the citizens of Nigeria.
Okay, so I feel like if anything needs to change, what needs to change is that people need to be educated about mental health. Maybe from while they are growing up, maybe the Nigerian government need to incorporate things about mental health into schools, so that people can be able to know about it while growing up. The same way we know about physics and chemistry, you can be able to know about this is what mental health means, this is what we should do about it, and how we should grow up and live our lives. I think if we do that, it will basically spread the idea very fast, and people will be able to mind their mental health while growing up. Yeah.
I would say, for one, people need to listen more. Like, I feel like most people listen, but they don't actually listen. Like, you can be on call with a friend now, and they are talking about, oh, I'm depressed, oh, I'm having anxiety, and they are telling you something else. Like, they are either pushing aside the subject, or they are not even listening to you. They are not actually understanding what you are saying. To them, it doesn't make sense. So instead of them to try to understand, they push it aside. So yeah, I feel people need to actually listen and not just hear you. Yeah.
What I think needs to change is awareness. I mean, proper awareness, proper health facilities, and proper caregivers.
Everything about how Nigeria approaches mental health needs to change, from the support they give to themselves or we give to ourselves, to the advice we give to ourselves, to who we can actually refer ourselves to.
Yeah, it's going to need change now. Like I don't talk before, now that education, we're going to need educate people. Like our people, we're going to need educate our friends, neighbors, family.
People don't notice patterns when it changes in other people. They just, oh, this person is this, person is that. This person is a snob, this person is that.
I've not witnessed any other person being judged because of their mental health. No, I'm not.
Yes, I've seen someone called lazy, called possessed because of their mental health issues.
Live in the moment. The past stays in the past. Heal from it. Forgive and forget. Forgive, you don't have to forget. And then don't be too anxious about the future. Just accept that you are the creator, because the creator lives in you. And if you understand that the creator lives in you, you can manifest everything. So if it's not coming right now, it's definitely going to come. So just wait for it and keep holding on.
My younger self. Okay, so I think my younger self, I've told my younger self to journal more, to not throw away my journals in those days, and that I should maybe have told people around me a whole lot when I was growing up. So I actually don't talk much to other people about the things I'm going through. I only journal them. But I think that there are some things I should have done, like talked to people around those times. Yeah.
More, I go tell my smaller self, say, guy, for this life, anything we dey go through, just find person talk to. 1, 2, they jam up to vibes 24/7. Anything we just they feel like say they wrong, just immediately vibes on vibe 24/7. Anytime you see me like this, if you don't see me with headset, earpiece, or speaker, guy, that means I don't get access to those things, or I go play on my phone speaker self. Always I dey on 24/7 jams, like 24/7. So, and food is very, very important. If you know they eat safe, if you know they eat well, your brain no go dey think well. You go come enter depression, you go define wetin dey cause am. But you know say na food wey dey lack, wey no dey chop, na im dey cause am. So once you dey chop food well and you dey jam, my younger self now go tell am say once you dey chop food well and I dey jam up to vibe 24/7, and I get person wey I fit talk to wey go listen to me. But even if I don't get person wey I fit talk to wey go listen to me, but as far as that music and food just dey, then we dey alright, we dey square.
See beyond that situation, because there's life after that moment and there has been life before then. So you learn to let go.
Well, what I would say to them is they should get help. They should seek support. There's support around you. Families, friends, support groups, mental health institutions, counselors, telemental health. All those people are available for you to seek help. Money is not a barrier. There are a lot of non-governmental organizations that are providing mental health support services for free. So you don't have any excuse not to seek mental health support. No matter how you feel, if you can't get up from the bed, get up and speak to someone. If you feel so reluctant to take your bath, get up and speak to someone. If you find yourself being edgy every time, being angry and not having things work your way, just discover yourself and know what works for you, and don't look at someone else's watch.
I'd say, don't give up, you'll be fine.
Seek help, go meet 1 or 2 people, go meet doctor, go hospital, and then vibes, prayer, and food is very important.
Mental health is also health.
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 Mental health now also health.